Dr. Kevin Kavanagh is a retired physician. He's also founder of a national group called Health Watch USA. Good morning, Dr. K.
Good morning, Jack.
Now, I guess we start out with some scary news, and that is this dangerous Brazilian variant that has been found in Michigan. What can you tell us about that?
Well, that's the P1 variant, and this is the Brazilian variant, as you stated, and this is more contagious and also appears to evade the immune system. This includes both reinfections and also, to some extent, and I have to stress some extent, vaccines. What is being stated is that they expect the vaccine will cause the person to become less sick if you get infected, but it will not totally prevent infections. And this means you could spread the virus. And that's one of the reasons why it's important to continue wearing a mask if you get vaccinated. If you get the worst case type of a strain of virus, because the vaccine does provide you protection, it's also important to get the vaccine. So you have to do both. And on the upside is that on Friday, we are now vaccinating 4 million patients or people a day in the United States. And so that is just phenomenal because the vaccines will blunt the severe cases and may well stop the spread of the virus entirely if it can get that R naught, or the ability of that virus to spread, below 1. In other words, it can't spread as fast as it needs to in order to reproduce.
Scary thought. Now the CDC... I'm sorry, go ahead.
Yeah, it is somewhat, but get vaccinated. That's the key. And keep wearing a mask.
And meanwhile, the CDC backtracks on vaccinated individuals spreading the virus. What's up with that?
Well, and that's correct. And I think it has to do with the parsing of words. I believe she is stating that if you were vaccinated, it's much less likely to spread the virus, even with the original wild strain of a virus. But with these new strains, we can't be assured of that. If you hear that the vaccine will prevent hospitalizations and deaths with the new strain, in other words, we're not talking about the UK strain, but this Brazilian strain, the South African strain, you're not hearing much about it will totally prevent infections. And if it doesn't totally prevent you from being infected, then you could still spread the virus. And this virus can still be very deadly in those that aren't vaccinated. And as we've discussed at length over the last 6 months, even if you get infected, if you wind up in the hospital, or if you get a good case of COVID-19, you might come down with long hauler syndrome, which can be seen in up to 20% of patients. So, Jack, it is of paramount importance for people to get vaccinated.
Can't preach that enough. Now, what about this study that found that COVID-19 has no effect with that, what is it called, ivermectin?
Ivermectin, yes. And we've had several calls on that last month. And this is a drug which is used in veterinary medicine. It's being used to treat parasitic infections or infections from like worms or parasites. And right now, the European Union and WHO states that there is not any effect of ivermectin with COVID-19. And on top of that, there's a recent study, which was a randomized controlled trial looking at adults who were infected with the coronavirus. And again, they found that there was no benefit for treatment of COVID-19. So this is not a good option. And it's another example of something that looks like it might be good in theory or in the lab, but when you get it in a person, randomized controlled trial, it just doesn't work. It just doesn't work out. And that's similar to what we've seen with hydroxychloroquine.
Dr. Kevin Kavanagh, as always, a pleasure, Doctor. I'll talk to you on Wednesday.
Thank you very much, Jack. Appreciate it, sir.